Alright, so today we're going to be treating a patient with what appears to be lateral epicondylitis. She is a 42-year-old construction worker, so she's active in a lot of supination and pronation movements. Generally what we would do first in treating her, we want to address the pain first and foremost over everything, but for Ther, we're going to go through 4 different exercises, 2 specifically for her lateral elbow, and then the other 2 will be focused more on her posture. So what we're going to get started with is some passive stretching for the lateral elbow. So what I'm going to have her do is extend her elbow, make sure her forearm is pronated, and then she can take her other hand and pull down at her wrist to flex it, and then from there you can radially or on or deviate it accordingly. I'd have her hold this stretch for about 15 seconds, and she'd do this 3 times, 5 or 6 times a week, and she could do this pretty much anywhere on her own. We would add it to the home exercise program. So then next we're going to do some strengthening for her wrist. So what I'm going to have her do, she can rest her elbow or forearm bring her forearm here on this little bedpost here, quarantine edition, and then she's going to hold this 1-pound dumbbell or toning stick. And what she's going to do, her wrist is already extended, but I'm going to have her slowly lower it down in the flexion, so that's the eccentric, go nice and slow, and then back up into extension. You do that a little faster. You just want to focus on the eccentric part of the movement, and I'd have her do this about 15 to 20 times. That's nowhere near failure. She just wants to get some movement, and we want to try to avoid pain with this. Sound good? So physical therapists, we treat impairments. So one of the things that we would address with physical therapy treatment is her overall posture, because it might put her elbow in a compromised position. So the first thing we're going to do is actually a core / trunk exercise. So I'm going to have her lay prone. Actually, we're going to lay it on the floor because you need a hard surface for this. Usually we use like the treatment table. So she'll lay prone. And then these are called prone cobras. So it's you've heard of a Superman before, but what she's gonna do is just simply raise up her upper body from the ground. She's gonna hold this for about 3 seconds and then back down. So what this is gonna address is her erector spinae and then her abs as well. She can do it one more time, just for demonstration. And then back down. So this will try to address the posterior pelvic tilt that she has. So what we're going to do last is we're going to address her scapular stabilizers as well as her shoulder muscles a little bit. In the past she had an accident with her right shoulder that's affecting her shoulder posture, and then that'll probably definitely put some tension on her elbow, probably leading to her chronic problems that she's been having. So we're just going to do the standard Y's and T's and have you demonstrate. We're going to use kind of like a little brace weight here, wrap this around, We're going to go proximal to the elbow to reduce the moment arm and try to not bring up any symptoms of her elbow pain with this movement. So first she's going to demonstrate the Y. She'll just raise up above her head, back down. Good. And then bring it straight out to the side for the T's. Good. Back down. She'd do this for 3 sets of 12 to 15 reps, either movement. And we do this 3 to 4 times a week. As well as the trunk strengthening, we'd also do that for about 3 to 4 times a week. So lastly, just to kind of like a take-home item for her, we could give her this brace, or she could go find one for herself. So anytime she's out doing her construction work and she's doing movements that require supination, pronation, etc. of her elbow, she could wear this to try to alleviate her symptoms a little bit.